welcome back. Dr. Hila, as you already did several surgeries on children from Pakistan, will you please share your experience?
Of course, I've been in this field for many years. I've done liver transplantation for since 1991, so that's 20 years I've done transplants.
But you look so young.
I'm not that young, actually. So I've been in London, and it's only in the last 1.5 years I've returned back to India. Mainly, I've returned back home to my own hometown, primarily to improve the situation there, because that is home for me, and it's okay to serve another country for so long. I mean, King's College Hospital has given me enormous experience, and we have trained a number of people from a lot of countries in London. We have trained surgeons from India, surgeons from Pakistan, surgeons from all over the world. We have a number of people who have worked in our program, have set up successful programs all around the world, in the Middle East, in Lebanon, in New Zealand, in Australia, in Ireland, in some Spanish program. We have trained so many people over the years, over 20 years, because King's College Hospital is a very large program. I still do some amount of work there. I've not given up my job in London, but I spend 5 out of 6 weeks in Chennai, and it's mainly to transfer my experience to the city I come from. In northern India there is a program, but in the south there is no program. And the idea is to actually make liver transplantation very successful in the region. India accepts patients from all over the region. I mean, I do patients from Sri Lanka, from the Middle East, a number of countries, they send their patients. And for these patients to go to the West for liver transplant operation becomes extremely expensive. In some of these patients, the government pays for it, and they are also conscious about the cost. The cost in India would be 1/5 of the cost in the United States, or 1/3 of the cost in the United Kingdom. And it's to bring the same high quality care as in the West at a cost that is affordable for patients in India. Even then, it's not affordable for the majority of the people. I mean, if a liver transplant costs 20 lakh Indian rupees, that's a lot of money. Again, it only addresses a small proportion of patients. So a Pakistani patient to travel to India is not going to be that cheap. So ultimately it needs to evolve. The need is there. Ultimately it needs to evolve in every country, really. And I've had an association with SIUT, Sindh Institute, for a long time, and they have ambitions to perform liver transplantation. And that is the public sector. And again, the private sector is the Ziauddin Hospital. Now, the idea is to initially to make them understand how to select patients, how to work up patients for transplants. And then maybe we do the transplants for 1 or 2 years, and how to manage these patients post-transplant. And then start off, once the technology is built up, start doing transplants here with our own guidance. Our team can come and help the local team do the transplant and look after. And it will be the same model in the government sector. Even in Ziauddin Hospital, this is a private sector. It may be cheaper than in India. Again, not all patients will be able to afford it. So ultimately, I think it is a partnership between private institutions and public institutions, so everything is available. Where I come from, there is a government hospital where people, the surgeons do successful liver transplant, even in the private sector.
In India, or what is the situation?
India.
Okay.
Yeah, in both
in government sector.
Government sector, the number's not huge, but they still are available. Even in Delhi, it's available in the government sector. In Chennai, the city I come from, it's available in the government sector. It requires a lot of...
It affects the cost?
In Chennai, it's done for free.
Okay.
Yeah, it's done for free. So that is what we need to be aiming at, ultimately, for it to be available for all sections of the society.
Okay. Now you are involving in the program, physician exchange program with Global Hospital and Ziauddin Hospital.
Yeah.
What do you think the future of both countries?
The success of such, this program would train people with us. There will be physicians visiting us from here and training them here, there, and ultimately training them in their own environment. So there will be physicians from there coming here and working with them during a transplant. And the success of all of this is going to be determined by successful liver transplant being performed in this country. So that is the ultimate aim of all of this, that the technology is transferred here. It might take time, it might take a lot of training and a lot of effort with costs involved. Ultimately, I do believe that liver transplants are going to be done in Pakistan successfully.
Okay, you are very much optimistic about the future of...
I am. See, I've been visiting India for many years, for 10 years, 15 years, and people have been saying, oh, liver transplants never come here, occasionally some transplants happen here and there, the results are not very good. And I've always told them, it will come there. If you work hard on it, it will come there. And now nobody questions that. Now it is accepted that liver transplantation produces good results in India, and it is cost effective.
Lastly, we would like to have a message from you to Pakistani people.
The first message is donation, really. When we go away, there is no contraindication in Islam. There is a fatwa in Saudi Arabia where people actually donate more organs compared to all other countries in the Middle East. So the first is really public education, and to donate after we die to save somebody else's life. That would be the first message. And the second message is for the government and for the health professionals. I think good quality professionals is the first thing, and then the investment comes. I think it is important that people train well and provide a good quality care, and then for the government to put the investments so these good quality people can be put to use to deliver the best results that we can achieve.
Thank you so much, Dr. Rela. Viewers, I hope you liked the interview with Professor Muhammad Rela from India, and I hope we will again bring some more important dignitaries in our Health TV. Till then, Allah Hafiz.